Good time to everybody. Thank you very much for making the time and the effort to watch this video. My name is Shamsi El-Hasani. I am consultant upper gastrointestinal surgeon, specializes in weight loss bariatric surgery. I lead on the bariatric service in my NHS organization. I am also the clinical lead for Kent Weight Loss Surgery Center at Chelsea Park Hospital, which is a bariatric center of excellence accredited by IFSO, which is International Federation of Surgery for Obesity. The contents of my video are my opinion based on my readings, my education, my experience with my patients, attending meetings nationally, internationally, and discussing with my colleagues. I am fully aware that my colleagues, who do extremely good job, may have different views on some of the points that I will raise in this video. This video is meant to give our patient a broad idea, a broad guidance about what to expect before and after the operation. So before the operation, especially for the sleeve gastrectomy and the gastric bypass, the pathway is both of them the same. It is very important before the operation to up your exercise tolerance. Whatever you can do to increase the exercise that you were doing before. This is important for the breathing, for your heart, for your blood pressure, for your veins, and make after the operation easier. And also there is evidence it will decrease the possibility of post-operative complications. Now we come to the diet before the operation. It is called liver reduction diet or called liver shrinking diet. Basically, fat is all over the body, and the fat in the liver can be a cause to make the liver rigid. It means it is not soft, it is hard. And in order to do these operations, the sleeve and the bypass, we need to lift the liver in order to reach the stomach. And if the liver is hard, cannot be lifted, unfortunately, once or twice a year, we just cancel the operation, abandon the operation, which is shame. Or if we can fight with the liver to lift it up, we may cause injury. So it is really better to be very strict with the diet before the operation and to follow it to prevent these problems. This diet is for 3 weeks for body mass index of 50 and above. It is for 2 weeks for body mass index of less than 50. I do not advise the milk diet or the yogurt diet or a specific calorie diet. I'll give you one A4 page. What is written in the A4, you follow it. What is not written, you don't take it, please. You will ask not to take sugary drink, not to take fizzy drink. Please drink. Please remember, alcohol is a fluid that have high calorie and increase the appetite. So the message, please follow the preoperative diet to make a safe, successful operation, and we don't abandon your operation. Remember, smoking decreases and impair wound healing. And I will suggest you stop smoking completely for 6 weeks before the operation and make it a life changes period with weight loss and stop smoking, which is very good for your health. And the week before the operation, you will be asked to the hospital, come to the hospital where you have a pre-assessment, which is standard anesthetic check and taking some bloods to prepare you for the operation. And it will give you the chance to ask healthcare professionals the final questions that you have before the operation. You will come on the day of the operation, have the same day, and you go home the next day, possibly by 5-6 p.m. the next day. You can stay if there is clinical need to stay, absolutely, but the usual is 2 nights, the usual is 1 night and 2 days, okay? We will ask you to walk after the operation. In fact, 2 hours after the operation, we will get you up and walking. I will ask you the first 2 weeks to do fast walking and walking that make your heart pounding, your breathing go up and down, and you sweat. It is very important, fast walking. After 2 weeks, I will advise my patient to do whatever exercise you want to do, whatever you fancy, and whatever it is feasible for you to do, whether it is jogging, whether a treadmill, a cross trainer, ball game. The only advice I give, the swimming, leave it for 3 weeks to make the wound, to make sure that the wounds had healed and closed completely. Walking the dog, walking to the station, walking at work is not the exercise I will recommend. Really, it is important to do exercise, A, to help you to lose the weight, and B, to maintain the weight loss. Going back to work, I would suggest do not commit yourself to any serious work on the first 2 weeks, but please do not delay going back to work for more than 3 weeks, because I would like you to go back to your normal life. Regarding what you can put it through the mouth, in the first 4 weeks, I do it over the top to prevent complication. You take liquids, anything that goes through a straw, you can take it in the first 4 weeks. The second 4 weeks, you will take soft diet, and after 8 weeks, you can eat solids. Dietitians are brilliant, and they will give you advice, and they will give you the option and help you with this period that can be difficult for some of our patients. I hope this will give you guidance for the pre-operative and post-operative, and please ask questions, especially at a pre-assessment, and I sincerely wish you a safe, successful, happy journey with your weight loss procedure.